Yeah, secondly, we've done a bunch of stories highlighting the disparities in vaccine access and in vaccine distribution across the city, where public and private distributors, the bulk of them are in Manhattan, south of 110th Street. The most vaccinated zip codes in the city are also typically in Manhattan, south of 110th Street. And just today, to pull up the chart again, the least vaccinated zip codes in the city are typically zip codes listed on your list of priority neighborhoods, and also places where you guys have made a number of announcements about trying to improve access. So I'm wondering, what isn't happening, right? So why is Far Rockaway? Why is Hunts Point? Why is Bed-Stuy? Why is Crown Heights? Why is Brownville? Why are all these neighborhoods still, 3 months into this, still at the bottom of the list when it comes to, places where shots are making it into arms?
It's a good question. I will start, and I'll turn to Dr. Choksi. Nolan, I think the pattern we saw in the beginning still is a fundamental issue here, although I think it's getting better. In the beginning, we saw a huge skew in terms of willingness to be vaccinated, and it cut very much along income lines and ethnic lines. That, again, I think that difference is closing over time. And we want to do everything to help close it more. And I believe when we get into the height of vaccination, which will be, this month, next month, June, as we really are getting ample supply, I think you're going to see that gap close more and more. But there has been a disparity in willingness and all the other challenges that go with an unequal society. Folks who have a lot of benefits have had a better time accessing, and that's something we have to be honest about. But our job is to overcome that, to go out in communities, to create grassroots sites, to do the door-to-door efforts, to do homebound seniors, all the things that we think will help to bring more fairness, equality to the process. And over time, I do think it will even up quite a bit. Dr. Choksi.
Thank you, sir. And yes, I also very much appreciate this question, because we have striven to make our vaccination campaign one that is not just safe and swift, but also equitable. And we have made strides, particularly with respect to race and place, in terms of closing the gaps that do exist. But I'll be the first one to tell you that we still have work to do. A lot of that, as you pointed out, has focused on improving access. And those 500 sites that are now publicly available, as I mentioned, is emblematic of making sure that people are able to get vaccinated, not just at a hospital or not at a mass vaccination site, but at their local doctor's office, at a pharmacy as well. And we've also, as Dr. Long mentioned, invested a lot in outreach, but you will see us double down even further in the coming weeks in making sure that we are getting out into neighborhoods and communities to spread the word about vaccination. And our commitment is to continue closing those gaps.